One of the most confused diagnoses for infertile women, and often very young infertile women, is so-called PCOS. That's Polycystic Ovarian Syndrome. PCOS just means that a woman is not ovulating or ovulating late in her cycle, has irregular cycles or very long cycles, and there are all kinds of crazy mistaken metabolic speculations and theories about this when it's really very simple. It's been theorized that these women have some kind of metabolic block, and then they're put on a drug called metformin with the mistaken idea that PCOS is just an infertility version of diabetes. And it isn't. Metformin is a terrible drug that is used in diabetic women to try to avoid them having to be on insulin, and it makes the glucose, the sugar, and the potassium go intracellular, so as to try to avoid the need for insulin in diabetics. That has nothing to do with PCOS. The reason for PCOS is too many eggs suppressing the FSH rise that would normally occur on day 1 of the cycle, so you don't recruit a dominant follicle. And when you don't recruit a dominant follicle early in the cycle, then you don't ovulate, your periods are irregular, and the treatment for that is IVF, because if you just stimulate such a case, you'll get so many eggs that you're in grave danger of multiple pregnancies. So the idea is to do IVF and to stimulate with a proper mini IVF protocol so you don't get too many eggs, and then fertilize the eggs, only transfer 1 or at most 2, and freeze anything that would be extra. So there's no danger to it, and you've given them minimal stimulation. They're not going to have hyperstimulation syndrome, and they won't have multiple pregnancies of triplets or quadruplets or something dangerous like that. So that's the simple answer to PCOS. It is not this complex diabetes-like syndrome requiring metformin, which is a terrible thing to put these women on who don't have diabetes.